Assalamualaikum everyone. Thank you so much for joining and sorry for the delay. We're trying to go live on YouTube, Facebook, but I think we managed to go live on the Facebook, so it is live on the Facebook as well. If somebody could not join our live here on the Zoom, they could join on the Facebook. So over to you, Asma, for the introduction, and then we'll make a start.
Thank you, sir. Hello and assalamu alaikum, everyone. Let me introduce myself. I am Asma, an executive member of Hive Medical Academy. I have been a part of Hive since the very beginning when Hive start first office opened in Islamabad. What I liked most about Hive was their mission to create ease for IMGs, to support them and help them reach the best position in their medical career in UK. The purpose behind creating Hive was simply to provide everything that IMGs need under the one roof. The person behind this great vision is none other than our CEO, Dr. Malik, who himself is an international medical graduate. He has 22 years of experience in NHS, from junior doctor to consultant. Today, we will not only receive his expert guidance, also, we are here to decode exam strategies and explore what comes after the test and address all your concerns about PLAB with our experienced PLAB tutor and academic lead, Dr. Omar. Inshallah, this session could be a turning point in your medical career, so please stay with us.
Firstly, thank you so much, Asma. Asma is our executive
Hello?
member in Islamabad,
Yes.
and thank you so much. Appreciate it. And very warm welcome to everyone, all the students from the WATIM Medical College, especially Rohab and his team. They have done extraordinary job with a very short time, and they have invited everyone to join and benefit from this very useful session. So today's session will be very interactive. हमने बातचीत करनी है, आपको बताना है कि आपने अगर यूके में करियर करना है, एनएचएस में करियर बनाना है, तो उसके लिए क्या कुछ किया जा सकता है. सो लेट्स स्टार्ट. आई एम गोइंग टू शेयर माय स्क्रीन वेयर वी विल टर्न. So could you confirm everybody could see my screen?
Yes, we can see.
That's great. Perfect.
Yes.
So we have got quite few participants, so please feel free करें. कोई भी क्वेश्चन होता है चैट बॉक्स में क्वेश्चन डाल दें. अगर उसके अलावा होता है मैसेज कर सकते हैं, कंटेक्ट कर सकते हैं. एंड पे हमारा क्वेश्चन आंसर सेशन होगा जिसमें से विल गो थ्रू एवरीथिंग इन डिटेल. आपकी जितनी भी वरीज हैं, जो भी क्वेश्चंस हैं, सो विल ट्राई टू आंसर दोज. और ऑन टॉप ऑफ इट आज के वेबिनार नॉट जस्ट इसमें यह है कि हम आपको बताएंगे चले जाएंगे. वी हैव गॉट 3 एक्सक्लूसिव ब्रेकिंग न्यूज़ कि जो भी कैंडिडेट पाकिस्तान से स्पेशली प्लैब के बारे में सोच रहे हैं, जिन्होंने प्लैब करना है सूनर और लेटर, आज करना है, कल करना है, हफ्ते बाद या साल बाद करना है, उनके लिए 3 ब्रेकिंग न्यूज़ होंगी. फर्स्ट तो हम कहते हैं जी कि हमारा कंटेंट सबसे बेस्ट है, बट वी आर गोइंग टू चैलेंज यू. वी आर गोइंग टू गिव यू फ्री एक्सेस, जिसमें 3 डेज की फ्री एक्सेस होगी हमारे प्लैब 1 प्रीमियम पैकेज के. ऑडियोज, वीडियोज, फ्लैश कार्ड्स, मॉक टेस्ट. आप उसको एक्सेस करें और डिसाइड करें कि आपने कोई भी कोर्स लेना है, किसी भी अकेडमी को ज्वाइन करना है, उससे पहले आप हमारे कंटेंट को असेस करें. इसे चैलेंज आपको लगे कि हमारा कंटेंट सबसे बेस्ट है, उसके बाद आप मूव फॉरवर्ड करें. सेकेंडली, everybody who is attending this webinar today, they will get 10% discount on PLAB 2. So this is second one. Third one, जो लोग पहले से ही PLAB 1 की तैयारी कर रहे हैं, मिडिल में है, एंड में है, या जहाँ भी हैं, जिस स्टेज पे भी हैं, उनके लिए है स्मार्ट प्रेप बंडल. उनको हमारे मॉक टेस्ट मिलेंगे वेरी वेरी चीप प्राइस, वेरी वेरी अफोर्डेबल, वेरी वेरी फ्लेक्सिबल प्राइस. मॉक टेस्ट मिलेंगे उनको, 2 डेज का बूस्टर कोर्स मिलेगा जिसमें से लाइव क्लासेस होंगी. आपको एनएचएस के कंसल्टेंट यहाँ से बैठ के बताएंगे एग्जाम के टिप्स एंड ट्रिक्स और हाई यील्ड टॉपिक्स. सो ये 3 चीज़ें हैं जो सारे वेबिनार्स के कैंडिडेट जो हैं वो अवेल कर सकते हैं. इसे ओपन चैलेंज टू असेस अवर कंटेंट एंड गेट बैक टू अस. सो लेट्स मेक ए स्टार्ट. Again, it's all credit goes to Rahab, his team, and all the team in WATIM Medical College for organizing this one. We really appreciate. and we're looking forward that we'll be doing some more similar webinars in WATIM and other medical colleges. So, aim and objective is abroad to UK, PLAB journey. what happens कि एक इंटरनेशनल मेडिकल ग्रेजुएट जब अपने कंट्री से दूसरी कंट्री में आने के लिए प्लान करता है तो उसको क्या क्या परेशानियां होती हैं क्या क्या मसाइल होते हैं और उनका सोल्यूशन क्या होता है so we're going to discuss everything if somebody planning about the PLAB journey. Again, you will get the insights into the PLAB pathway for international medical graduates. We'll address all the key challenges and potential hurdles, obstacles faced by the international medical graduates, and clarity about the PLAB myths. There are quite few PLAB myths which people still they think that oh this is true, but we're going to clear those confusions today. Brief about me. I'm one of international medical graduate. Moved to UK a long time ago. Completed my training from junior doctor to consultant, and being in NHS for a long time, and now supporting, facilitating all international medical graduates from Hive platform. So let's start from first thing. Whenever you plan something, especially the moving out of the country, out of the city, financial pressure, how much is going to cost, how you're going to afford it, how much will be the exam fee, how much it will traveling cost, flight cost, accommodation, 6 months stay in the UK, visa immigration process. Again, is need to think about moving to different country. What's the application process? What's the immigration rules, regulations? How long visa will get it? And if you are not a fresh graduate, you're working at any stage of your career, ये सोच रहे हैं कि मैंने जॉब कर रहा हूँ जॉब के साथ मैं पढ़ाई कैसे करूँगा और फैमिली कमिटमेंट्स हैं इनको कैसे चीज़ों को करना है and most important moving to different country different culture different healthcare system how I'm going to adapt to the UK culture UK community UK people these are the questions potential questions whenever somebody plans moving out of the country out of one healthcare system different these they come in their mind once you have decided obviously next thing you'll think when should I apply PLAB how often is the PLAB exam and how I'm going to prepare. There are millions of resources available on the internet. Are they all credible? Are they going to help me to pass my exam? And who prepared those resources? So there's lots of confusion. When you have so much choices from internet, and then you become confused and you start believing on myths and things, then you end up nowhere. Again, visa application process, how to going to book the ticket, moving to different country if you don't have family friends how are you going to book your accommodation are you going to rent a property where you going to live who is going to pick you up from the airport so these are all the questions which we're going to address today and these are a list of the questions we while speaking to thousands of international medical graduates so when we spoke to them we asked their concerns and questions while they planned the journey so we compiled this list but if anything is missing from the list, please just inbox us and we'll address that as well. Pressure of succeed if you are spending some money, obviously you will be thinking about you I must pass this exam. If I can't pass, then obviously it will be waste of my money, waste of exam fee, waste of your time, energy, everything. PLAB exam structure. There is again is a limited guidance about because it's a different type of exam. While you're in medical school, you have got a different sort of exams, and according to your country, you have got a different. But when you're moving to abroad and specific healthcare system, specific exams, you must know the structure, and then you should prepare according to the blueprints culture system transition from one healthcare system one country one culture to different culture UK is a different culture different people different environment so how are you going to transit make this transit very smooth and pleasant without any guidance very important still today's date there's so many myths about PLAB journey people think PLAB is easier PLAB is not easier exam uh, second is PLAB guarantee a job in the UK. So first, PLAB is easy only once you have got proper tutor, proper people who have got exposure to NHS, who have worked in NHS, and who know everything about the PLAB journey. They are guiding you, they are on your back, or they are supporting you. If you have not got these sports, PLAB is not easy exam. Passing PLAB guarantee you everything. A job? No, not at all. Passing PLAB is means like passing any other exam, any other test. It's a piece of certificate, it's a piece of paper. Till you have got other things which are very important to do it. What are those things? After passing PLAB, your attachment. You must understand the system where you're going to work. You must know the system. NHS system is different if you're coming from, especially from Pakistan, healthcare system is different. And if you're coming to UK, healthcare systems, you must understand. So how you will understand that system, how you will know the system, how it works, how the doctor behaves to patients, how the nurses, what the role of nurses, healthcare assistants, all those. So this only you can get sort of the taste of NHS system when you do clinical attachment. Once you're doing the clinical attachment, you're working closely with the junior doctors, with the consultants, with the GPs. They will give you intro to the NHS, and that will make you more confident. You have got the knowledge, which was assessed in your PLAB 1 and PLAB 2, but now you need to put your knowledge into practice. So how are you going to do that? That you will learn during your clinical attachment. And if you don't do clinical attachment, your CV is not very good. And if you have just a lab thing, and it will be very hard to secure a job because clinical attachment is not easy to get it. If your CV is not up to date according to NHS template, and if you have not got CBD courses, you haven't got resources, you don't know about the interview. Because when you apply for the job and go for the interview, they're not going to ask you, have you passed lab or not? That's done and dusted. Next step, what to do after lab, which is very important. And every candidate who is trying for the PLAB, they must understand that after PLAB 2 exam, there's the time, there's 4 to 6 weeks when you're waiting for the PLAB 2, must utilize 4 to 6 weeks, those 4 to 6 weeks to prepare yourself for the jobs. Get the clinical attachment, get the mock interviews, get the CBD courses, and once you get the PLAB 2 result, apply for GMC registration, and you're ready to get the job, and you make yourself stand equal to the local graduate or the graduate from the other countries. And if you have not done those things, you will lack these things. It's very unlikely you will secure the job. UK culture and medical practices are too difficult. This is again a myth. It is not a myth at all uh, because you could work like myself. I am an international medical graduate and I worked here very well for 22 years. And there are 52% international medical graduates who are working in NHS from junior doctor to CEO to top levels, all top positions they're working. So UK culture is very friendly, very sportive. They guide you, support you throughout your career. Again, another question people ask several times that, we could take PLAB at any time in the year, how many times are unlimited times attempts are. No, it is not. uh, you have got only 4 times. PLAB 1 happens only 4 times in a year, and PLAB 2 is again every day. So PLAB 2 is not issue. PLAB 1 is 4 times every February, and then you have got May, you have got August and November, and you have got maximum attempts you're allowed in the PLAB 1 are 4 attempts. If unfortunately, if you can't pass your PLAB 1 exam in 4 attempts, then you need to provide some evidence that you have improved your skills and knowledge to GMC. Then it's entirely up to GMC to decide either to uh, give you the fifth chance or not. Sometimes GMC will give you the fifth chance, sometimes would not. Again, after that, for the PLAB 2 exam, you have 4 attempts allowed. And if you can't do it in 4 attempts, then you need to provide evidence that you have improved, you have got special training, and then you could do the fifth attempt according to GMC if GMC allows you, but you must provide the evidence. So you please keep admitting people they're coming, so they're not appearing on my screen. Right. Again, PLAB is only for the junior doctors, so no, it is not. You can anyone at any stage of their career, they could take the PLAB 1 exam. It's better if once you are in final year, you can plan it properly. So once you have done your degree, you can start your foundation program here. But anybody, any doctor who is at any stage of career, any age, they can take the PLAB exam. There is no age limit or restriction today for the PLAB exam. While working full time, this is again myth. You can't prepare now. With us, what we do, we prepare a study planner. Whether you're taking PLAB 1 or PLAB 2, we'll give you a proper study planner, which will balance your work life, and then you can easily do your PLAB 1 and you study your PLAB 1 exam and PLAB 2 as well. Meeting eligibility, we will discuss in the second half of the presentation. There's a discussion about what's the eligibility for the PLAB one and who can take the PLAB. After PLAB, start working immediately. No, as I said, there are lots of things you must do after your passing PLAB exam, especially those 4 to 6 weeks while you're waiting and you have nothing to do it. You must secure your clinical attachment. You must do your clinical attachment during those time. You must have your CV done. You must done completed CBD courses. You must completed your mock interviews. Without clinical knowledge, that's again is another myth. You can't pass your PLAB 1 without clinical knowledge because in PLAB 1 they assess only your clinical knowledge. They're not going to assess any practical thing. So PLAB 1 completely is about the clinical knowledge. However, is similar to your FY2 level or your final year professional exam. So it's all clinical knowledge. PLAB 2 centers available worldwide? No, not at all. PLAB 1 you can take anywhere. For PLAB 2, it's only in the UK, in Manchester, near our office. So for PLAB 2, everyone has to come to UK. A brief summary, I would say that, what we did, what we discussed, like understanding the PLAB exams, financial strain is again is a difficulty. Then we have got time management and study, adapting to UK healthcare system, how you're going to prepare for the language test, also OET, emotional psychological stress is also again is big uh, reason, obstacle, or worry when somebody who hasn't moved out of their city, and if they're planning to move out of the country, that's a big of financial, social, emotional strategy for them. So again, these are the things which you need. Sometimes some people they need additional support. So these were some summary of some worries, concerns, obstacles for international medical graduates. They could think of it, the potential things. Uh, Most important thing, how Hive Medical Academy support international medical graduates. So I usually say that at Hive Medical Academy, whatever we do, we put international medical graduates at the center of everything. They are at the heart of everything. And it gives us great pleasure whenever international medical graduate who pass their exams with Hive Medical Academy, they say that we treat them like a family. We treat them like their own kids. So this is how we support international medical graduate. If you ask me in one line, two liner, for how medical academy supports, so we treat everyone like a family. We hold their hand from the day one. Once they plan, once they're thinking of taking a PLAB journey, we hold their hand. We ask them just relax. Let us do everything. We just focus on your study. So we have got everything. We have got the team with decades of experience of NHS who have been clinical and educational supervisors, mentors, who have been lecturer, who have been ASCII examiners, and top of it, we have got the true, correct, credible resources and tools to guide, support, and empower international medical graduate. So we have got all those things, all those resources which are required by any international medical graduate to start and complete their NHS journey, their PLAB journey. So this is why we put them in the heart of everything. Exam preparation, mental well-being, because myself being going through the journey, I understand the journey very well. So we just not focus on the study. We support them from our sort of the holistic care we provide. We support them from financial point of view. We support them from mental well-being. We support them from their work if they're working, and we work with them to make sure they pass their exam and get start the journey in the NHS. We customize everything according to the client's needs, according to their needs. Our mentorship and support is extraordinary. The people who have spent decades in NHS, they know how to support, how to make sure all the candidates they pass their exams. What are the tips and tricks? What are the important things? What are the resources? What's going on according to GMC blueprint and what they need to pass their exams. So these all resources and all those things, the team they come together to support international medical graduate. One put them together and then everybody who is with Hive Medical Academy, they pass their exams in first attempt. And then we make sure they get job as well. Passing exam is not, we don't end there, our sport. We continue till they get the job, they start their career. And even after that, if they need support to bring their family here or any other thing, they want to buy a new house, they want to buy a car, everything, we stand with them. You can feel free to go on our website or our social media. These are some success stories where our international medical graduates who have taken their exams with us and they have passed their exams successfully, and they are working in NHS from junior doctor to consultant here in NHS. Briefly, I will go through some of the benefits working in NHS. You all might be aware that NHS is the largest or biggest employer in the world. NHS was established in 1948 and is still going on a state-funded health facility. Everybody gets pre-treatment. On top of the employees of NHS, the doctors, nurses, healthcare assistants, they get a huge amount of benefits. You get the paid annual leave up to 41 days. Uh, want to buy a new house, a car, you get easily the loan, mortgage, everything. You have got discount from small thing to big things. Like you want to either you're going to buy bread and egg, or you want to buy a house, or you want to buy a Lamborghini, or you want to buy a Ferrari, you'll get the discount. Everything is there. Apprenticeship schemes for your children. If your children want to go into apprenticeship schemes, that's specifically for the NHS employees. So huge number of benefits while working in NHS. Right, so journey to the UK, how it starts. If you're in final year, fourth year, final year, start thinking about it if you want to have a career in the NHS. You will plan it. The first step will be your passing your meeting your eligibility. You should have a medical degree, then pass your IELTS or OET English test, PLAB 1. Move to the UK, do your PLAB 2, and start your career in the NHS. These are the steps you need to start your career in NHS. These are few things what the PLAB 1 exam day, what happens, what you need if somebody is taking exam next week, it's 22nd, PLAB 1 is exam, and I strongly recommend them contact us. If your exam next week, do check our smart prep bundle where you have got the 2 days PLAB 1 booster course where will have, which will be really very helpful to pass your exam. So you have got week left. So if anybody is interested to take that one, please do contact us and we will help you to make sure you pass your PLAB 1 exam on 22nd of May. So as I said before, the ultimate goal is you just focus on your studies and we will help you to pass your exams and get you job in the NHS. These are some of our services. Quickly, I would say again, just for people, some people they joined later on. So everybody who is attending the webinar today, they have got the 3 great discounts or 3 great breaking news for them. 10% discounts on the PLAB 2 premium package till 31st of May. Then you have got the free access to PLAB 1 premium package. So this is sort of the challenge we anybody in the Pakistan who is planning to take the PLAB 1 exam and they have not tried any other resources, we challenge you to access our resources and decide yourself what resources are best. So you will have access to our PLAB 1 premium package. You will have audio, video, you have the full mock test, you have a clinical flashcards, you have got pharmacology flashcard. And these are designed according to latest GMC blueprint. These are our resources. Have it try for 3 days free of cost and you decide yourself what are the best resources. And if you want to carry on, just you can contact us. And third thing is a smart prep one bundle, PLAB 1 bundle where you get the mock test, you have got the 2 days booster course for the PLAB 1 people who want to last minute revisions, you want to pass their exam. So this is very important. So anybody who wants to avail these things, please do get in touch with us. Right, I will stop here and I need to pass over to Dr. Omar now. Dr. Omar is co-founder and our academic lead, and he's been in NHS more than 15 years. He's been clinical supervisor, education supervisor. He's been tutor in Manchester University. He's been ASCII examiner and loads. He loves teaching and people love his teaching. So I will let him take over from here and then we'll carry on further. Thank you, and over to you, Dr. Umar.
Thank you, Dr. Scale. Good afternoon, everybody. Assalamu alaikum. Hope you're all doing well. Thank you very, very much to Dr. Rahab and his whole team and all of you guys for sparing your time this evening. It's evening for you guys, not afternoon. And coming and joining us to learn about your possibilities for the UK. Really appreciate all the effort that's gone into arranging this. Thank you once again, and thank you to the whole Hive team also. Okay, so I'm just going to share my screen. So just bear with me for a few minutes, please. Okay, so for anybody, please confirm कर लें कि screen नजर आ रही है, if you can see the screen.
Yes, we can see it, yeah.
Okay, thank you. So मैंने बहुत ज़्यादा देर नहीं spend करनी on myself, लेकिन I'll just say a few things. So I was born in the UK. I'm not an IMG, लेकिन I spent around 15 years in clinical practice in the NHS. मैंने बहुत ज़्यादा काम किया NHS में as a junior and then as a um, a consultant in family medicine also. And I spent many wonderful years with lots of IMGs. My family is originally from Pakistan, तो बहुत ज़्यादा links हैं. We recently visited as well. It's always a pleasure. And so I kind of understand the journey that you guys have from the other side. So मैं दूसरी side से देखता हूँ because I'm in the UK and I grew up here. I went to medical school here and I did my training practice, and then went into academics, examining, supervising, teaching junior doctors, GP trainees, etc. for many years. So teaching is my thing, and so hopefully, if any of you guys do decide to join Hive, तो फिर we will be speaking a lot, discussing a lot, and spending quite a lot of time together. So that will be really good. As Dr. Skeel mentioned, there's three things that you need to be aware of today. I'll mention them again थोड़ा सा in a few minutes. But हम जाते हैं अपनी agenda की तरफ. So Dr. Skeel has spoken about the journey for IMGs, उनके worries क्या होते हैं, उनके challenges क्या होते हैं. So मैंने थोड़ा सा focus करना है on the process and in terms of the steps that you need to take as an international medical graduate. So हमने discuss करना है the steps to get to the UK. थोड़ा सा हमने ये भी डिस्कस करना है कि आप प्लैब एग्जाम्स को कैसे अप्रोच कर सकते हैं, व्हाट आर द ऑप्शंस फॉर यू, और हमारी क्या एडवाइस है कि इन एग्जाम्स को कैसे अप्रोच किया जाना चाहिए. एंड देन हम थोड़ी सी बात करेंगे ऑन आवर स्टडी रिसोर्सेज और प्रैक्टिस मटेरियल्स जो हमने प्रिपेयर किए हैं पर्सनली. So first of all, it's a good place to start to speak about the journey of an IMG. तो क्या आपकी कौन सी steps होंगी? What's important for you? What do you have to do? First of all, you will have to be a medical graduate. तो आपने MBBS या MD or other equivalent qualification आपको मिलनी चाहिए. So I understand most of the audience today is medical students. So you guys will hopefully, even अगर आप early medical school में है, doesn't matter if you have a goal, आपकी कोई goal है, आपका कोई vision है, तो फिर ही आप उसके लिए plan कर सकते हैं ना. So even if you're not in 4th or 5th year, it doesn't matter. You can start thinking about the steps, and you can start preparing for the steps that you need to take. So first of all, MBBS. After that, you need to prove your English competency with either IELTS or OET. And we'll speak a little bit about this in a few slides, or in a couple of slides time. फिर आपको pass करना पड़ेगा PLAB 1, which you can sit in Pakistan. PLAB 2, which is a practical exam, उसके लिए आपको आना पड़ेगा to the UK. And then after that, there are some certain steps that you will need to take to increase your chances of success in getting a job. Most importantly, things like doing a clinical attachment and a few other things as well, which we'll speak about in a little bit later. But obviously, UK में काम करने के लिए you have to be registered with the GMC, and आपको license to practice you need to have a license to practice. Okay. And then hopefully after all of these things, you can reach step number 7, which is securing a job. Okay, so English competency का के लिए दो options होते हैं. There's IELTS, which is you probably heard of IELTS. It's an international English test. It's been around for a very, very long time. And there are two types. There is an academic one, and there is a different one. So it's the academic one you need, and you need to score at least 7 in each testing area with an overall score of 7.5. एक और option भी है, लेकिन there's an option for proving your English competency using the OET, which is the Occupational English Test. ये test जो है, it's a bit more suited to healthcare professionals. So doctors भी इसको करते हैं, nurses भी करते हैं, any other healthcare professional जो है, dentist हो, it's more suited क्योंकि इसका content ज़्यादा relevant है for healthcare professionals. And in this one, you need to get at least a grade B in each testing area. So speaking, listening, reading, writing. And the general consensus is लोग कहते हैं कि the OET is slightly easier. So we always recommend that you attempt the OET. And English proficiency prove करने के लिए, obviously you guys are taught in an English medium, so that's good. लेकिन still it's फायदा होता है कि अब you get some tutoring, you get some coaching, and you prepare properly, क्योंकि आपका फिर time ना waste हो और पैसे भी ना waste हो. And we do preparation for English courses as well, including both the IELTS and the OET. Okay, फिर इसके बाद आएगा आपका PLAB 1 का step. So PLAB 1, most of you probably will know, is a written exam. It can be done in a computer center, or it can be done with the old-fashioned pen and pencil and paper. So ये multiple choice questions हैं, 180 questions, 3 hours. So काफी time pressured है. You have 1 minute per question, and really you need to answer the questions in about around 50 seconds, 45 to 50 seconds. Excuse me. क्योंकि फिर आपको few minutes बच जाएं at the end to review things and make sure you answer all the questions and answer the ones that you missed because they were a bit difficult, this kind of thing. तो ये you will be used to this kind of exam. आपने इस तरह के एग्जाम की होगी already in medical school in terms of the structure, कि एक छोटा सा सिनारियो होता है, उसमें डिस्क्रिप्शन होता है कि so and so Mr. John Barnes is 55-year-old patient who presents to A&E with chest pain or some other clinical scenario, फिर थोड़ा सा information आता है उसमें कि these are his investigations, yeah, these are the clinical findings, and then which of the following is either something like the next best step in management, or which is the most appropriate investigation, or which is the most likely diagnosis. इस तरह का वो structure होता है उसका. So it's a type of exam which you will be used to, लेकिन it's not although it's a knowledge based exam, ये questions जो है इसकी ज़्यादा focus होती है on applying your knowledge. तो for example उन्होंने ये नहीं पूछना आपसे कि you know, give us some causes of clubbing, for example, or what are the potential causes of pleural effusion. It's इस तरह की questions के angle नहीं होती. It's more about applying your knowledge. जैसे मैंने ऑलरेडी बताया था, यू कैन सिट प्लब 1 इन पाकिस्तान. 2 सेंटर्स हैं इस्लामाबाद में, एक है और एक है कराची में. सो फॉर यू गाइज इन वतीम, इफ यू ऑल फ्रॉम वतीम, देन इस्लामाबाद इज कन्वीनियंट फॉर यू. सो दैट्स प्लब 1. इसकी प्रेपरेशन के लिए इट डिपेंड्स ऑन योर where you are in your career, how much experience you have, but most candidates will do the preparation for PLAB 1 in around 3 to 4 months. और इसके लिए भी we have packages specifically designed just for PLAB 1. So जैसे मैंने ऑलरेडी बताया, इस फोकस इसका है clinical scenarios, and it's about applying your knowledge. काफ़ी ज़्यादा proportion of questions जो होंगे, they will be from acute scenarios, emergency focused scenarios. Primary care भी काफ़ी ज़्यादा highly feature करता है इस exam में, because the vast majority of the clinical work that you will do as a junior doctor will be will be the kind of things you are likely to see in primary care as well. So long-term conditions भी आते हैं, chronic disease भी आती है, emergency scenarios भी आती हैं, and there will be lots of all of the clinical areas that will be covered. वो उसके बारे में I'll explain in a couple of slides. लेकिन apart from just clinical knowledge, ethics भी आते हैं, ethics are relevant, communication भी relevant है, professionalism भी आती है, and these kind of things, ये topics हैं जो IMGs find difficult, जो मुश्किल होती हैं for international medical graduates, because the medical curriculums in Pakistan are now catching up. So हम recently पाकिस्तान में आए थे टूर के ऊपर, and lots of places are doing integrated medical curriculums, and lots of places are doing ethics and all of these kind of things. लेकिन things might be slightly different. So still आपको input की ज़रूरत होगी and guidance की ज़रूरत होगी, and that's where our resources and our guidance will come in. So students fikr karte hain ki, what kind of questions will there be? So obviously these are just a rough guide. As you would expect, the biggest area would be general medicine. It's general medicine and general surgery. So around 30-35% general medicine ke questions honge, including all the major medical specialties. फिर general surgery and sub-surgical specialties, 15 to 20%. Pediatrics, फिर जो major जो specialty areas हैं, pediatrics, obs and gynae, psychiatry, they will have 10 to 12%, all around 10%. Psychiatry, emergency medicine, same kind of things. फिर ethics, professionalism and communication है. इसमें आ जाती हैं चीज़ें like consent, confidentiality, the GMC's guidance on things like whistleblowing and all of these kind of things. And एक हमारा student था yesterday who मुझे पूछ रही थी कि you know how important is ethics in PLAB 1. तो मैंने उसको बताया कि इस you know percentage questions के vary होते हैं between about 5% and 10% or sometimes higher. लेकिन questions जिस तरह लिखे जाते हैं ना उसमें there's always some element of professionalism or potentially some element of ethics or some test of the way you are thinking as a doctor. So it's very, very important. ये areas बहुत important होते हैं, even though the pure ethical questions might not make up a large number, लेकिन these kind of professionalism and ethics concepts ये apply करेंगे on a lot of the questions. अब फिर इसके बाद आती हैं smaller topic areas like statistics, pharmacology, public health, and specifically medical legal scenarios around things like patient autonomy, complaints, these kind of things. Okay, so that's an overview of PLAB 1. जैसे मैंने बताया, it's a written exam, something you guys will be well used to. One word of caution about preparing for PLAB 1. So we speak to lots of candidates for PLAB on a weekly basis, if not a daily basis. हमारी बहुत ज़्यादा बात होती है उनके साथ regularly. और वो use करते हैं resources that are very well known and they've been around for a long time. लेकिन they're not always up to date, and they also tell us, वो हमें भी ये भी बताते हैं कि हम they're in WhatsApp groups or discussion groups or Facebook groups, and they use mock exams, mocks or certain resources which are prepared by colleagues in Pakistan and in India. Now, without meaning to be disrespectful, because हर कोई, everybody prepares good resources, everybody tries to guide people correctly. लेकिन unless you have, अगर आपने यूके में काम नहीं किया, अगर आपने इधर मेडिकल स्कूल में स्टडी नहीं किया, या स्पेसिफिकली आपने इधर काम नहीं किया as a clinician, तो फिर आपकी जो अंडरस्टैंडिंग होगी वो प्योरली थियोरेटिकल होगी. You won't be able to give real world guidance to students when they ask you the scenarios or when they ask you these questions. So आप अपनी experience को नहीं ला सकेंगे into the questions or into the guidance that you pass to people who are your students. So this is where Hive is different. हम UK में based हैं. Obviously हमने already बताया, we have connections in Pakistan, we have connections in other places as well. लेकिन हमारी clinical experience जो है और academic experience, examination experience, teaching experience is heavily UK based. So इसका फायदा resources में आता है, and you will see, hopefully, if any of you guys take up our offer of a free trial. So 72 hours के लिए you can access a section of our PLAB 1 premium package. So आपको इसमें नजर आएगा कि हमारी resources कैसे हैं, क्या मिलता है, and why it's different to other people. Okay, let's move on to PLAB 2. So PLAB 2 जो है वो it's a practical exam. It's an OSCE style exam. And medical students आप लोग भी used to होंगे OSCEs, Objective Structured Clinical Examination. Practical examination है 18 stations, 16 scenarios होते हैं, 2 rest stations होते हैं. And as I mentioned before, PLAB 2 sit करने के लिए you have to come to the UK. GMC की test center जो है, 2 test centers जो है GMC के, वो UK में ही है, मैनचेस्टर में specifically, जहाँ हमारी academy based है and where we live. तो उसको to attempt PLAB 2 you have to visit Manchester. ये भी काफी लंबी एग्जाम है, it's over 3 hours. आपको a minute and a half मिलता है कि आप सिनारियो को पढ़ें. You get some information outside the station, which will tell you कि inside, there's so and so. Either take a history or do an examination, or maybe it will direct you to do both, or it might direct you to do a practical procedure or something. And so आपको 90 seconds मिलते हैं कि आप उस टाइम में आप अपना plan formulate करें. And then you go into the station, and each station is 8 minutes. So 16 stations, 8 minutes for each station. लेकिन what is the focus of the PLAB 2 exam? हमने already कहा है कि PLAB 1 जो है, it's a knowledge based exam, but it's not purely recall. It's applying your knowledge. Knowledge को apply आपको करना पड़ता है to the questions. So what gets tested in PLAB 2? PLAB 2 में 3 main domains हैं जहाँ where the marking is focused. Number 1, data gathering. Data gathering में आ जाता है आपके history taking, physical examination skills, any practical procedures, any knowledge of investigations. So ये होता है consultation का first part, which is normal in any consultation you have with the patient, whether you do it with a real patient or whether you do it with a simulated patient. Data gathering. Second part जो consultation का होता है, that is clinical management skills. So that's always the second part. Second part में आप क्या करते हैं? You have to either explain a diagnosis to the patient or a differential diagnosis, और आपको explain करना पड़ता है कि आपका management plan क्या है, या what are the more appropriately, कि what are the management plan options. उसके बारे में we'll speak in a few minutes. What is the focus of consultations in UK based medicine? So आपने diagnosis का explain करना है, और आपने explain करना है कि किसी procedure के बारे में कि आपने you're going for a colonoscopy में क्या होगा. So it's something where you are now doing less listening and you are doing more talking. And then the third domain, तीसरा domain जो है वो है interpersonal skills. Essentially वो ये है आपकी communication skills, कि आप किस तरह पेशेंट के साथ rapport establish करते हैं, किस तरह बात करते हैं उसके साथ. What type of questions you ask? Do you ask open questions, closed questions? आपकी आप पेशेंट को कैसे इन्वॉल्व करते हैं in the consultation, in the conversation? आप प्रोफेशनलिज्म डेमोन्स्ट्रेट करते हैं? Do you demonstrate understanding of ethical principles? What is your body language like? Are you a good listener? Do you pick up cues, verbal cues, physical cues, body language cues? Are you a good communicator? That's the main focus of interpersonal skills. So you will see from this कि इसमें आपकी knowledge भी टेस्ट होती है, आपके कम्युनिकेशन स्किल्स भी टेस्ट होते हैं, आपके प्रैक्टिकल स्किल्स भी टेस्ट होते हैं, आपकी हिस्ट्री टेकिंग भी टेस्ट होती है और हो सकती है, आपके एग्जामिनेशन स्किल्स भी टेस्ट हो सकते हैं. सो इट्स लाइक अ कंप्लीट पैकेज. लेकिन ये दिस इज व्हाट आई वांटेड टू शेयर विद यू गाइस, कि जो व्हाट मोस्ट पीपल डोंट अंडरस्टैंड, उनको नहीं पता होता है कि PLAB 2 एक्चुअली कितनी वेटिंग है फॉर द मार्क स्कीम. सो ये 3 डोमेन्स हैं. Communication and interpersonal skills makes up 50 to 60% of the mark. तो इसका मतलब है कि आप आप पेशेंट के साथ कैसे बात करते हैं, उसको कैसे सुनते हैं, कैसे इंटरेक्ट करते हैं उसके साथ. All of the things I just mentioned before makes up at least half or more than half of the marks. और फिर आपकी clinical skills और examination की skills 30 to 40%. And then application of knowledge. So knowledge भी important है in PLAB 2. ये नहीं कह सकते कि वो नहीं important है. लेकिन what's more important is the clinical skills and examination. And what's most important are your interpersonal skills. So why am I explaining this? मैं क्यों बता रहा हूँ ये आपको? मैं इसीलिए बता रहा हूँ because you might be a very good clinician in the sense that your knowledge is good. You might be an excellent diagnostician. You might be really good at, you might know everything there is to know about all of the major conditions you are ever and minor conditions you are ever likely to see. However, आपकी communication में weakness है. आप properly patient से information ले नहीं सकते. In English, remember, English में होना है ना सारा. आप प्रॉपरली उसको इंफॉर्मेशन दे नहीं सकते. आप आपको आपने कभी ये प्रैक्टिस नहीं की कि आपने पेशेंट के साथ नेगोशिएट कैसे करना है, बिकॉज दैट्स व्हाट अ कंसल्टेशन इज. मैं whenever I do these webinars, usually when we have an interactive audience, मैं उनसे पूछता हूँ कि what's the or seminars, what's the purpose of a consultation? तो my understanding after 20 years of learning and practicing medicine is consultation जो होता है ना, वो is two people meeting, the patient and the doctor. Now UK में there is no paternal relationship. In our own countries this is probably less and less true, लेकिन still थोड़ा सा मुझे लगता है कि ऐसे होता है कि the doctor takes the paternal role and the patient takes the child role. Or what happens, the doctor gives advice to the patient. It's all one way होता है. Patient आपका problem present करता है and the doctor gives advice. लेकिन in the UK this is not how medicine, this is not how consultations are practiced, and therefore आपको you will need to demonstrate a different way of doing a consultation with a patient. और वो क्या है, वो ये है कि आप दो लोग हैं, आप डॉक्टर हैं, आपकी अपनी एजेंडा है. You have a medical agenda and an agenda to help this person in front of you. जो पेशेंट है उनकी भी अपनी एजेंडा होती है. हो सकती है कि इट्स मोस्टली मेडिकल, लेकिन ये भी हो सकता है कि they are feeling low, they are feeling a bit depressed, they are feeling a bit lonely, they are feeling afraid. So all of these kind of things are going around in the patient's head. और आप दूसरी तरफ हैं, you're thinking my main job is to diagnose the patient or treat the patient. That's true, that's part of your job. लेकिन what you have to do in a consultation is you have to ensure as the person leading the consultation कि आप both same page पे end up हो जाते हैं, जहाँ आपकी agenda भी meet होती है और patient की agenda भी meet होती है. And how do you know what is the patient's agenda? We need to ask about what their worries are, what their ideas are, what their concerns are, and then we need to listen. And at the same time हमें उनकी मेडिकल प्रॉब्लम को भी असेस करना है, और फिर उनकी जो अदर इश्यूज हैं जो उनके ज़हन में फिर रहे हैं उनको भी असेस करना है. सो इट्स अ वेरी डिफिकल्ट स्किल, बड़ा मुश्किल है, लेकिन it's will be something new for you, and this is why you need people who have practiced this way of medicine, who've taught it, who've examined it, to actually teach you and coach you and watch you and give you live feedback to get you to improve. So that's the main focus of PLAB 2. So just quickly मैं बताता हूँ कि what happens in the stations. So stations में simulated patients होंगे. You'll be used to that with actors. There might be some models, something for you to examine, like an abdomen or something. Or there might be a high fidelity mannequin which interacts with you, which gives you clinical signs. Or there may be practical procedures. So catheterization, venipuncture, arterial blood gas, blood gases, or something else you would expect of a junior doctor. But there is usually an interaction between you and another person. ये हो सकता है कि it's between you and a simulated patient, or it might only be in writing. There might be a prescription station, or it could be via the telephone. So these are the possibilities of the types of stations that you will get in PLAB 2. So इसके बारे में मैंने I've touched upon some of the things that you will need to do to do well in PLAB 2, लेकिन we'll just refresh it. So you have to appear slick, and you have to appear like you have done this hundreds, if not thousands of times. मैं हमेशा बताता हूँ कि I examined Huskies for pretty much 10 years almost. Or when you examine for that long, you get very experienced, और आपको पता चल जाता है within the first 30 seconds sometimes who is going to do well and who is not going to do well, or who has come in with a plan, or who has come in and they look like they know what they're doing. So you have to appear confident. You have to show empathy. Empathy is very, very important. But you also have to, you have to be decisive as well. So you have to, आपको listen भी करना पड़ता है बहुत ज़्यादा, लेकिन आपको बोलना भी पड़ेगा. And then you will also have to try to lead the direction of the consultation, because sometimes वो इस तरह चले जाते हैं. They can go in different directions. And obviously you must do all of this without any appearance or signs of arrogance or irritation or anger or anything. And this is a difficult skill. It takes lots of practice and lots of coaching. Patient-centered होना पड़ता है. Patient-centeredness क्या होता है? Patient-centeredness means that everything about the consultation is all around the patient. उनकी concerns है, उनकी worries है. जैसे मैंने बताया, they have their own agenda. आपका अपना agenda होता है, लेकिन the patient's one must take a high priority. And you must be safe. So you mustn't miss red flags. You mustn't say or do something inappropriate. You mustn't miss a potential serious diagnosis, all of these kind of things. So it's a lots going on. There'll be lots in your head rushing around, even though आपने cardiovascular history thousands of times की होगी, लेकिन this particular scenario in front of you means you have to be flexible, you have to be agile, you have to hold back from saying what you want to say because the patient wants to say something. So it's a complicated skill. And I think Shahid, I forgot to mention right at the very beginning, what is the level of the PLAB exams? Just to reassure some of you guys. So most of you guys here, I think medical students हैं. So the level of the PLAB exams is at the end of FY1. FY1 जो है foundation year is the equivalent of the house job or your internship year. So it's not a high level exam in terms of the knowledge that you require. लेकिन एक तो obviously it all needs to be UK relevant knowledge. And number two, there's lots of skills which might be new. आपके लिए new होंगे. All of the things I'm speaking about in this part about PLAB 2 that you have to demonstrate. So you guys can, and I'm sure you will all pass it. Lekin it's important that you get the right guidance, you use the right kind of resources, and the things are planned out for you so that you know what areas to focus on when. Okay, so this slide, इसमें you will see the pass rates of the PLAB 1 and PLAB 2 exams. So ये pass mark नहीं है. It's not the pass mark. The pass mark varies depending on how well the particular group does. लेकिन ये pass rate है. So you can see between 2020 and 2024, so the last full 5 years, between 25 and 30, 34, 35% of people fail PLAB 1 or PLAB 2. Now, ये stats जो है ये GMC से हैं. They're not, we don't know ये first attempt है उनका, second attempt है, third attempt है, whatever. लेकिन I just put this here to show that so a significant proportion, around a third of people fail their PLAB 1 or PLAB 2. Could be multiple reasons, individual reasons भी हो सकती हैं, there could be personal reasons, but it seems to be a consistent trend, as you can see, across the 5 years. So there may be other reasons for this that we have our own ideas on. Okay, so this part I'm just going to be, I'm just conscious of time. I'm going to try to speed through the last couple of areas. So when it comes to approaching your PLAB exams, there are multiple possible approaches. You can be organized or you can be disorganized. आप academy को join कर सकते हैं or you can try it as an individual. लेकिन what is the best way to approach the PLAB exams? Let's have a look at the evidence. So I think nobody will need convincing it's better to be organized than disorganized. So we won't spend too much time on that. Again, what's the difference between doing it yourself and doing it through an academy? Difference ये है कि number one, you will get, as I already mentioned, expert guidance, support from your peers, and you will get a guided framework. You will get resources जो up to date हैं, and they're relevant, and the questions and the notes and the things you get are actually in line with NICE guidance and the UK-based guidelines and the GMC good medical practice principles, etc., etc. They won't be, taken from here and there or anywhere else. On your own, there's higher risk of errors. There's high risk of using resources that are perhaps out of date or not as good, and there's lots of uncertainty. आपको mentorship seek करनी पड़ेगी from people who've already done PLAB or maybe who are doing PLAB, but they haven't worked in the NHS. उनको real world experience नहीं है. They haven't examined or taught PLAB. So it's not the same. Both approaches are not the same. So there's a few थोड़ी सी slides हैं on the evidence for different approaches to preparing for PLAB, but licensing exams in general. So I'll go through these very quickly. Multiple studies from reputable resources like the Journal of Medical Education, British Medical Journal, all of these others showing that consistently, वो students जो structured plans को follow करते हैं, जो peer-led study sessions or observed feedback के साथ वो अपनी preparation करते हैं, they consistently do better, between 25, 30, or even 40% better in their licensing exams. Okay, so इस presentation का दूसरा हिस्सा भी है, but I think I will focus on, so I'll leave the international versus UK healthcare systems and the cultural competence kind of thing, because that's thoda sa is a bit more relevant when you are starting your PLAB journey, perhaps. But I will go to the training program. Just before doing that, I'll just touch on the parts that I've just skipped over. So मैंने mention किया है कि आपकी training थोड़ी सी different होगी from people who are studying medicine in the UK. इसका मतलब है कि आपकी skills थोड़ी सी different होंगी, आपकी way of communication थोड़ी सी different होगी, and then there's things like the cultural differences. जब आपकी language second language होती है, English is your second language, so there's certain things that are more difficult for you to understand. So ज़्यादा practice की ज़रूरत है, and वो भी एक natural English speaker के साथ it's important that you practice these things, because जैसे मेरी उर्दू है, आपकी उर्दू will be 10 times better than mine. and I will miss things in a conversation that you guys will pick up, and vice versa. So जब English में आपने skills demonstrate करनी है, you need to increase your skill level in English and in the communication in English, and वो you can only do that by being taught by or being observed and getting feedback from people who are native English speakers. Patient care approaches be different here, and these are the kind of things that we cover in our resources. Okay, so just very quickly, this is the last section. This is an overview of the foundation program. So just briefly, ek do slides hain on the structure of your potential career in the UK. So जो foundation year program है is foundation year 1 and 2. Essentially वो ये है कि it's the equivalent of your house job in Pakistan, but it's 2 years. So after FY1 आपको you have to do FY2, after completing FY1 you will get full registration, but you're still having to work under supervision as an FY2. And then after foundation program, you can go to specialty training. So either it's important to mention that there are 3 main career route options in the UK. एक तो है specialty training, through which you can become a consultant, a physician, or a surgeon, or a consultant in family medicine, or pediatrician, or obstetrician, or psychiatrist, whatever. So that's one route. दूसरी route ये है, the other option is you can work as a locum. So I think locum की concept नहीं है in Pakistan. That is where you are essentially an independent contractor and you can offer your services to clinics, surgeries, hospitals at whatever level is appropriate for your skill and training level. And you're working independently, but you're providing a contract for services. So you are giving medical services in return for receiving pay, but you're not employed by the hospital or the GP surgery or whatever. So that's the second option. The third option ये है कि you don't pursue training, specialty training. You can work in a particular area of medicine, surgery, psychiatry, pediatrics, whatever, as what would be called a staff grade. So you're quite a senior doctor, and sometimes you're almost, in terms of your experience, you might be the same as the level of a consultant. लेकिन you haven't done, आपने वो membership की exams नहीं की, you haven't done MRCP, you haven't done MRCS, so you can't get a certificate of completion of training, or you won't get a certificate, and so you can't work independently as a consultant. लेकिन I know I've worked with many doctors who इस तरह का career path उन्होंने choose किया, and they were very, very good, very experienced. They earned very well as well. Locum ways of doing practicing medicine are also very lucrative, and specialty training is also. So I already mentioned specialty training can vary between 3 years for GP training to 9 years for other major surgicals and medical or other specialties. Okay, so finally, so why हमने काफी ज़्यादा चीजें discuss की हैं. So I'm just going to finish on our solutions, what our offers are. So I'll just, you can read the slide, lekin I'll just summarize it in 2 or 3 points. Number 1, whatever your learning style, however long you have until you want to pass the exam. We've had people who हमारे पास आते हैं, मेरा PLAB exam सिर्फ 1 महीने में है, I need to prepare, and so we prepare them. Or they come very organized, well in advance. I want to start my preparation, and we do a full. We tell them about it will take 3 to 4 months for PLAB 1, this long for PLAB 2. We have courses that are already prepared. They are running. You can do them online. You can do some courses face to face. Dr. Skills already mentioned our PLAB Smart Prep courses, which is a new thing, which are shorter, less commitment, much more better, much cheaper as well than the main courses. So whatever it is you need, we will help. We've even delivered customized courses as well. People say, come and a few students came to us and say, we want face-to-face teaching for 4 weeks. So we said, okay, no problem, we will do it. So whatever it is that you need, whatever help आपको चाहिए, हम वो deliver कर देंगे आपके लिए. What makes us different from anyone else? Again, I don't want to spend too long here, but number one, the makeup of our team. As we said, the amount of NHS experience mixed with the experience of being an IMG, is what is really good in the team. And the second main thing is that it's a really, really personal academy. All our students, वो उनके पास हमारे पर्सनल व्हाट्सएप नंबर्स हैं. I get messages on a daily basis. They ask me all sorts of things. They ask me about questions they don't understand, concepts they're struggling with, and they even approach us for help with other things not related to their courses. So you will get a really personal experience with Hive. So just before I hand back to Asma or Dr. Shakil, because we'll have some question and answers. I'm just going to mention again the three things that Dr. Shakil mentioned. So number one, we currently have a 10% promotion, 10% off promotion on our PLAB 2 courses. Number two, everybody who's attended the webinar today, we can send you details of how to experience our LMS and our PLAB 1 premium package for 72 hours for totally free of cost. अगर आपको होता है ना कि I need to see, I want to know, I want to build a bit of trust, I want to see what the resources are like, what makes these guys so different. And the third thing, oh yes, the PLAB Smart Prep courses. So these are new, much shorter courses. So 2-day courses. So maybe if you feel, you've done आप PLAB 1 आप feel करते हैं कि you can prepare yourself, but you need a bit of help. So the PLAB 1 smart courses might be the thing for you. So everybody's different. हर किसी के confidence level different है. Or so there's various different options available. I've spoken for too long now, so I'm going to hand back to Dr. Skill. Thank you for listening, everyone. It's a pleasure to speak to you this afternoon. We'll answer all and any questions that you have.
That's good. Thank you so much, Dr. Omar. That was a great. So we are open for any questions. Anybody has got any question, please feel free to unmute yourself and ask anything and everything. We are here to help and we're here to answer.
Alternatively, अगर आप if you're microphone shy or camera shy, you can drop your question in the chat box, and हम उधर से भी आपकी question को pick up करके answer कर लेंगे.
And everybody who registered, उनको अभी email मिलेगी, WhatsApp मैसेज भी मिलेगा जिसमें से आपके लॉगिन क्रेडेंशियल होंगे हमारे LMS के, लर्निंग मैनेजमेंट सिस्टम के, जिसमें से आप हमारे फ्री प्लैब 1 प्रीमियम के रिसोर्सेज एक्सेस कर सकते हैं 3 डेज के लिए. ट्राई योर सेल्फ एंड डिसाइड योर सेल्फ. उसमें सबसे बेस्ट ये है आप वीडियोस देखें, ऑडियो सुने, क्लिनिकल फ्लैश कार्ड्स हैं, फार्माकोलॉजिकल फ्लैश कार्ड्स हैं, और ये सारी चीज़ें अकॉर्डिंग टू जीएमसी ब्लूप्रिंट से की गई हैं. आप उनको देखें और डिसाइड करें कि आपके लिए बेस्ट क्या है. प्लैब स्मार्ट प्लैब प्रेप बंडल्स वो भी अवेलेबल होंगे हमारी वेबसाइट पे सून. उसमें आपको मॉक टेस्ट हैं, 2 मॉक टेस्ट चाहिए, 5 मॉक टेस्ट चाहिए, 10 मॉक टेस्ट चाहिए आपको कि लास्ट वीक रह गए हैं, 2 वीक रह गए हैं एग्जाम में, या फिर आपको 2 डेज का क्रैश कोर्स चाहिए, वो भी अवेलेबल है. उसमें से भी आप वो कर सकते हैं. सो एवरीथिंग इज देयर अगर आपने अवेल करनी है.
So normally
Anybody else
जब
can?
nobody
हाँ.
has any questions, इसका मतलब है या तो everybody understood everything or nobody understood anything. So it's always good to have a bit of interaction. So please, feel free. It can be, doesn't have to be about PLAB, doesn't have to be about, it can be about anything about working in the UK, yeah, other routes, other options, etc. So,
I think there is
uh,
a question.
yeah.
Right. What about the course charges? I want to ask a question. Yeah, feel free to ask a question. What about the course charges? अभी आपको फ्री एक्सेस मिल रही है, पहले असेस करें, ट्राई करें. अगर आपको अच्छा लगता है कि यस दिस इज फॉर मी, सो जैसे पहले हमने कहा है कि वेरी फ्लेक्सिबल है. हमारा है कि आपको क्या नीड्स हैं उसके मुताबिक आप होगा. मिनिमम चार्जेस हैं हमारे कोर्सेज के. हमारे कोर्स आप प्लैब वन प्रिपेयर कर सकते हैं 15 पाउंड से लेके whatever you want. So it starts from 15 pound only. सो आप ट्राई करें हमारी रिसोर्सेज और उसके बाद बताएं कि यस यू लाइक इट एंड व्हाट यू वांट. व्हाट इज द रिक्वायरमेंट फॉर द गुड सीवी? दैट्स अ गुड क्वेश्चन. सो your CV NHS, they have got a specific template for the CV. So whatever you have done it, it should be according to NHS template when you're applying for the job. So majority of डॉक्टर इंटरनेशनल मेडिकल ग्रेजुएट जब आते हैं तो वो उनको सीवी का जो है ना नहीं पता होता. वो उनका टिपिकल अपने कंट्री का हर अपना सिस्टम होता है, उसके हिसाब से उन्होंने किया होता है, तो वो सीवी मेजॉरिटी टाइम रिजेक्ट हो जाता है. सो दिस इज़ वेरी इंपॉर्टेंट कि आप किसी से जो एनएचएस में काम किया है, जिसको कंसल्टेंट है, जिसको एक्सपीरियंस है, वो रिव्यू करें आपका, और आपका सीवी अकॉर्डिंग टू एनएचएस टेम्पलेट किया जाए. और वही फिर आपका एनएचएस जॉब के प्रोफाइल में जाएगा, ट्रैक में जाएगा, आपके जितने भी लोकल एजेंसी के साथ रजिस्ट्रेशन वहाँ पे जाएगा. सो वो विल कम्प्लीटली गाइड यू. जैसे मैंने पहले कहा कि आपके 4 to 6 वीक्स होते हैं प्रेप टू एग्जाम के बाद. तो वो 4 to 6 वीक्स को हमने बड़े प्रॉपरली यूज़ करना है. उसमें आपकी क्लिनिकल अटैचमेंट कराएंगे, उसमें से आपका सीवी को करना, आपको मॉक इंटरव्यू के लिए प्रिपेयर करना. बेसिकली विल गेट यू रेडी फॉर द जॉब. सो यस यू सीवी इज़ वेरी इंपॉर्टेंट. there is another question. Yes, go ahead. How long the whole process take? Why should I choose you? How do you candidate receive the results? What are the next steps after passing PLAB? PLAB 2 GMC registration. Right, so let's one by one. Yeah, the first question, how long will all the process? So the PLAB journey, it takes 9 to 12 months. That's the entire from your English test, and then you have to pass your PLAB 1, PLAB 2, and then the job. That includes the time for the waiting for the results, preparation, and everything, 9 to 12 months. If you plan properly, you have got study planner, you have got proper guidance, like you have got the academy with you, and then you have got the tutors like Hive Medical Academy, then it will take 9 to 12 months total process. Why should you choose us? इसमें पहली बात तो पहले ही हमने कहा कि हमारे रिसोर्सेज आप खुद देख लें. यू डिसाइड, यू बिकम द जज. सेकेंडली, हमारी टीम इज विद डेकेड्स ऑफ एक्सपीरियंस. थाउजेंड्स ऑफ डॉक्टर्स को हम सपोर्ट कर रहे हैं सेवरल ईयर से, आज जिन्होंने एग्जाम सक्सेसफुली पास किए हैं. और मोस्ट इम्पॉर्टेंटली, वी हियर टू फैसिलिटेट. वी पुट यू एट द सेंटर ऑफ एवरीथिंग. क्योंकि हमारा काम यह है कि आप बताएं कि आपकी कैसे हेल्प हो सकती है. वी हियर टू हेल्प यू. वी हैव द रिसोर्सेज, we have got experience, we have got skills, we have got dedication. So you tell us how we could make you successful. So we'll stand with you like your shadow till you pass your exam, till you get the job. What are the next steps after passing PLAB 1, PLAB 2, GMC registration? Yeah. So once you done your PLAB 1, after that you need to apply for the EPIC registration. All your documents should be verified, approved, and then you apply for the PLAB 2. Will help you to get the visa support. We will complete your visa application with us. We'll issue you the letter. We'll book your accommodation, all those things. And once you come here, you pass your PLAB 2, and those 4 to 6 weeks will arrange your clinical attachment. We'll do your CV. We'll guide you about CBT courses. We'll give you free access to CBT courses. We'll do your mock interview session 4, and then definitely we'll get you ready for the job. We'll make your job profile. We'll make you register, get you registered with local agencies. So we'll do everything which is required to get a job. What support does Hive Medical Academy offer for PLAB 2 preparation? Everything. For the PLAB, and especially we said that we have got 10% off for the PLAB now. PLAB 2, we have got the two courses. We have got the PLAB 1, PLAB 2 online course, where you have got audios, videos, you have got loads of cases, you have got 1100 uh, flashcards, which include CKS guidelines, NICE guidelines. You have got DNA CPR, palliative care, end of life care, and all those things are, and you have got several case reviews, you have got the practice cases. So that's the online course. Then you have got your face-to-face course in the academy in Manchester, where you come and you can have 10 days where you'll practice, and you have the mock test, so you are ready to take your PLAB 2 exam. So we do everything which is required for your PLAB 2 exam, and we make sure you pass your exam. Help us only in making our CV better and according to NHS template. With whatever you need, we are here to help you. If you need just the CV services, you said you need to get your CV done. Yes, yeah, we could do. We are here to help you. Anything you need, whatever we know, will help you. That's not issue. Either you need just for the PLAB 1, or you just want to do your OET exam, or you just want to do PLAB 2, or you just want your mock test. Whatever you need, just tell us and we're here to help you. Guide us more about the templates. Yeah, definitely. That's the templates. Depending upon whatever the CV, once you share your CV, हमने आपका CV रिव्यू करना है, देखना है कि आपका एक्सपीरियंस क्या है, आपने क्या किया है, उसमें है क्या. So then accordingly, वो obviously we will prepare your CV according to NHS template. Is if I tell you things now that you have to do this thing, no, I need to review your CV. What is in there? So how we need to organize that according to an NHS template. So this is very important. And if you have got your CV needs to be done, please get in touch. Any of our team member, just drop us an email, info@hivemedicalacademy.com, and send us your CV. We need to review your CV. Then we'll be in better position to guide you कि yes, हमने इसको ऐसे ऐसे करना है जिससे आपका CV शॉर्टलिस्ट भी हो जाए जॉब के लिए और जॉब के चांसेस भी हो जाए. Any other question? Please feel free if you want to speak up. Yeah, feel free to speak up. If not, just keep putting your questions in inbox. We're here to answer. What documents are required for registration? How does Hive Medical Academy approach to teaching different providers? How does the Medical Academy provide personalized? Yeah, I think I will let Dr. Umar to answer this one. The past year. Yeah, come on.
Yeah, sure. So the documents for registration I will leave to Dr. Skeel. But how does Hive Medical Academy's approach to teaching differ from other providers? So I think, as I said, we have lots of teaching and examining experience on the team. So our difference will be that number one, you will be taught and examined and receive feedback from us personally, the most senior members of the team. What other places might do sometimes is you have someone leading the whole team, you only see them once, or you only have one session with them, then you don't see them again, and then you have people who have just passed the PLAB exams themselves. They have no experience of working in the UK. They have no experience of teaching, training, examining, so that they're really not very qualified to do what they're doing. With us, you will have the sessions with us. We'll be there the whole time, be taught by either myself, Dr. Shakil, or other senior members of our team. And we will always assess you first and then decide how best to prepare you. And that's where I think we will be different. How does Hive Medical Academy provide personalized support to students? So I already gave an example of having access to the most senior members of the academic team at any time. So I've told all our students they can message me anytime with anything that's worrying. And as soon as I have an opportunity, usually most of the time it's the same day, they will get a response. How does Hive Medical Academy's course structure help candidates succeed? So structure के साथ ये होता है कि you first of all you will have a consultation with myself. You will speak to Dr. Skill, but then after that, you will speak to myself. We'll have an academic conversation. I will speak about your experience, try to understand what level you're at, and then we will provide you with a plan based on how long you have until your exam. Everything will be in the plan, what to do on what days, when to use questions, when to use mocks, uh, and uh, and then that is obviously you will need some self-directed study as well. Like, we'll always be there to provide the support, and then once we'll have live sessions with you guys, also live classes, and then when it's PLAB 2, there will be an online component and also paid face-to-face teaching bhi hogi, where we will do it personally. So documents for registration and the pass rate, I will let Dr. Skill
Okay, thank you.
mention.
So you just need, if you're a doctor, you need your MBBS degree. That's it. For with the Hive registration, you don't need any documents or anything. As far as you're a doctor and you're a medical graduate or you're finally student, we will start preparing you for PLAB. Pass rate up to now is 100%. All our students, they got the maximum score. The last exam, our students, they got 92% score. So we are proud to say that we have got very good students who have passed exam and we supported them. What if unfortunately somebody gets failed in attempt? Should we have to prepare? This is the beauty of our courses that we don't have to pay with the same fee. You will be able to pass your exam till you pass your exam. So we don't charge you if unfortunately. First we try our best and we make you to try best as well so that you pass your exam in first attempt. But unfortunately, if you don't pass, you have got 12 months access. So you don't have to worry about it. As I said before, we're here to facilitate and support and do everything which could help you. Another thing which I mentioned, all for medical student doctors who are coming, whatever you will be spending for your exam fee, or preparatory fee, courses fee, like your OET, PLAB 1, PLAB 2, or courses fee. Once you start your job, when you do your tax returns, you will get back all this money. Either you have spent £500 or £5,000, you will claim back and you will get all this money once you start your job. So you are not losing anything. This is the investment you are making for yourself and which you will get back from NHS or HMRC. So this is majority of doctors, they didn't know that they could claim back. Same for the nurses. If whatever they have spent for during your preparation of exam, they will get back. So you claim back everything. Any other questions? Go ahead if you have any questions.
Even अगर आपको अब कोई question ज़हन में नहीं आ रहा, you can contact us afterwards, anytime, through the website, email, or WhatsApp to ask your questions. So please, guys, आपको जब email मिलेगी, do take advantage of the 72-hour trial because it's not going to cost you anything. You just have to spare a bit of time, थोड़ा सा time निकालें, resource को देखें, have a look at an example of the quality of the resources, and then you can decide yourself, okay, if you think it's worth it or not. And then have a discussion with us about, when you want to think of when you want to prepare, how long you might have, when you want to start, then we can discuss detailed options with you.
Right. So I think if there's no question, we will be moving towards closing this session now. You will get the email. That email will contain your username and password to log into LMS. You'll go on our website. You'll click login button, put your username and password. But we're going to include some tutorial for LMS. So that message or email you will get, that will include links to videos which you should watch, how to use the course and how to register and how to get things. So you have got your username and password. You'll go on website, log in, and start using. But watch the video how to use the resources. You'll have the video, audio, mock test. So that will give you best idea about the resources. Right. Thank you so much once again, everybody from WATIM Medical College, especially Dr. Rahab and his team, and the rest everyone for organizing this one. And hopefully we'll continue such activities again soon maybe the next month, in a couple of weeks' time. So if you have got any questions and any unanswered questions or anything else further comes up after reviewing our resources, we will answer all your questions. So thank you so much and take care. Allah Hafiz. Allah Hafiz.
Thank you, everyone. Thank you for joining. Allah Hafiz.